open now. We will continue with the PG's segment. So this case has been already discussed by the last class about the hyperparathyroidism, which you can see in the panoramic image. Now this is a developmental anomaly where you can find ankylosing of the PMJ. This is a 7-year-old girl named Natalie, simple to us, with a complaint of limited mouth opening on Christmas. So she gives a history of trauma during childhood, especially at the age of 2 to 3 years. So she and her parents were going to a small picnic bus. The bus met with an accident and they fell down. So the small little baby, which was present with her parents, fell down from the bus and the face got hit on the ground. Followed by that, bleacher, baby stopped opening the mouth and since they are from very poor family and they are actually staying in a rural area, they thought that this might have been happened due to trauma and they have waited for a long time. And slowly, which resulted in ankylosing of the PMG due to trauma happened during that accident. So they came to us with the complaints of limited mouth opening, and on investigation, we found out that there is ankylosis on both the right and left side of the PMG. And the treatment for this patient was we have done the surgical technique for the patient, and we have removed the portion of the ankylosed bone, which is ankylosed in these two areas. And this is the image after the surgical procedures. So we can find the left side, this reduction area is the complete removed portion of the ankylosed bone here. And here also we have slightly removed here. So when you compare this radiograph and this radiograph, you can find the differences here. Now, this is an interesting case came to us. The patient's complaint was taking sound while opening and closing the mouth. So whenever the patient is going to yawn or patient is going to talk loud, the patient is going to open his mouth for having some large food materials like an apple or a bun, a severe clicking or poking sound was heard. And that was feeling embarrassment for the patient, especially in the public or during sexual gathering. So we visited us to find out the main reason for that. And we found out that on opinion investigation, there is actually bifid condyle present on the right side and the left side of this patient. So this anatomical radiation which is happening on both the right side and the left side might be the reason for this squeaking sound happening for the patient. And there is no actual treatment for this other than the surgical remodeling of the PMJ. We have convinced the patient regarding the anatomical radiation and the reason which causes squeaking sound for him. Now you can find this is a case where the patient came to us with the complaints of trauma followed by pain while opening and closing the mouth. On OPG investigation, you can find there is a fracture in the neck of the condyle on the left side. The same fracture you can see in the parasymphysis region. So this is a Batten fracture. So a direct blow to the mandible results in the fracture here and an indirect fracture in the neck of the condyle. Now, the patient came to us with a large swelling on the left mandible, and you can find there is a large unilocular to multilocular adjacency, which is very large in size, and there is an impacted molar, and all the lesion is actually encircling this impacted molar. And the diagnosis of this case came as keratocystic or endogenic tumor, or previously called as OKC or endogenic keratosis. Surgical excision of the lesion was done in this case. So this is the case of trauma presented to us, and a complete lower mandibular segment is actually separated. In this case, you can see here all the portion has been damaged and fractured. And this is a case where the patient presented with swelling in the left mandible, and on investigation we found there is an impacted tooth in the left mandible, and from there the lateral surface of the lateral variety of pedigree cyst. The same thing you can see in the right side also. The follicular size is more than 2 to 3 mm, and here also we have to diagnose this as pedigree cyst and uniocular radiolucency and circling and impacted tooth. The surgical excision of this cyst has been done on the left side and both on the left side, along with the removal of the impacted tooth, and the biopsy report came as pedigree cyst. Now, this is a diabetic patient who came to us with a complaint of loosening of the teeth in his oral cavity and a severe foul smell coming from the oral cavity. So he is a forest officer. Most of the time we will be in the forest rural area, and he came to us for a thorough screening, and on investigation we found out that there is a generalized loss of neuronal bone that resulted in this mobility, and his diabetic level was more than 300 during the investigation. So this is a diabetic induced periodontal affected with this patient. Yeah, this is a case of aneurysmal bone cyst. The case presented with a large and huge swelling, and the OPG revealed multiple multilocular radiolucent lesion covering the entire mandibular portion. You can find small internal septa in and around this large lesion that is happening from the left mandible, the posterior region of the ramus, extending into the anterior portion, crossing the midline, going to the right side. All the mandibular portion is affected with this. Now, this is a case where the patient presented with severe pain on the TMJ and sometimes occasionally having clicking on popping sound. So, on investigation, when you compare on both right and left side, there is severe osteopenia, and the pencil-like features of severe osteoarthritis can be seen, or the TMJ arthritis. The shape of the condyle has been changed. Here, the condyle is completely, the concave shape of the condyle is completely gone. And here you can see that it's like a slice has been cut from the portion of the superior head of the condyle, and this space is decreased here, and this space is decreased here. So this is the case of orthoarthritis, osteoarthritis of the TMJ. This is a screening test after placing an implant. So these are the main advantages of an OPG, because a single image will help us to cover a larger anatomical area. And since every procedure things are actually set up with the machine, the technician has to only instruct the patient what to do, make the patient to stand for like that for 16 to 17 seconds and show the X-ray. The radiographic image will be visible within a single scan. And the technique, the procedures, everything is actually totally tolerated by the patient, because we are not going to keep anything inside our cavity which causes gagging or discomfort for the patient. So when you compare for a full mortality graph, you need to take minimum 9 to 10 intraoperative data. So instead of taking 9 to 10 intraoperative data, a single OPG image will be helpful for the patient, and also that single image will give the data which is required, and exposure to the patient also can be reduced by that, and the errors can be reduced minimized. But the disadvantages of this image is that the image is actually less sharp. The reason for that is we're taking this image by keeping the X-ray source and the field outside the patient. Once it is an external radiographic image, a large amount of this got superimposed. So the clarity, the resolution, or the sharpness of the image will be less when you compare with any other imaging modalities that what you are using inside the hospital. And how the shape of our jaw is actually a vertically V-shaped or a curvilinear manner. And this curvilinear shape of the arch we are converting into a flat single image in an OPG. So in some areas, especially in the premolar region of both right side and left side, it will show a small amount of overlap. That is one thing because of that. And the machine is actually a bit expensive when compared with other intraoperative machines. So this is the comparison of panoramic and graphical radiograph to find the clarity and also the sharpness of the image. So small peripheral pathologies, periodontal pathologies and all. If you want to find the proper lamina or the peripheral pathologies, this type of things are actually not better. The best thing to do is to go and to take for peripheral filling. So when you prescribe an investigative modalities like OPG to a patient, always keep in mind that OPG is not good to identify a lesion in a single tooth. Always prefer to set the patient investigation for taking multiple tooth. And in case of a peripheral or biting, filling is actually preferred in case of dental cases. Periodontal involvement if you want to check for one or two teeth, or in case of earlier peripheral pathology. So now coming back to different principles or the mechanism of how OPG works, this is very important. The first thing is called as tomography, then comes scanography, then comes the filling and the eccentric rotation. And there is something called as rotation center, and then there is photography. So coming to tomography, the concept of tomography is that it is a radiographic technique which images one layer or section of the body while blurring the images from the structures in other place. The concept of tomography is that you heard of anatomy, right? Anatomy. Anatomy is the study of body by cut sections. That is called as tomography. So, as I said earlier, the shape of our arch is like actually a V-shaped arch or a curvilinear arch. And to study about that, in the OPG technique, each areas of our dental arch is scanned by different sections. That is called as tomography. So each area is scanned or imaged in one layer or section, while blurring the other sections from the body or from the jaw. That is called as tomography. So now you see this is the lateral section, this is the frontal section, and this is another lateral section. So each section is scanned at a time. First lateral section is scanned, then the frontal section is scanned, and again a lateral section is scanned. And then they will combine all the section portion into together. So while you combine all these sections together, slowly the image will be coming like this. This is the concept of tomography. Then comes the technique called as scanography or narrow beam of radiography. The radiographic beam, which is used to scan these sections, are actually a narrow vertical beam which is coming from a vertical slit. And this is called as slit beam radiography, which will be scanning the different areas of our jaw. So there is this beam actually comes from a small vertical slit that is exclusively meant during the manufacturing of an OPG machine. And that slit is actually kept at 4-degree angulation in a negative manner or in a minus 4-degree manner in the OPG machine. So the collimator which is used for producing or restricting the size and shape is a narrow vertical slit like collimator is used in panoramic machine. So the X-ray tube head and the film will actually rotate around the patient. That is next thing. Then a rotation center. Rotation center is a very important point. It is the also called as a pivotal point around which both the X-ray tube and the film will be rotating around the patient. Different types of rotation centers are there: double rotation, triple rotation, and moving rotation. And the rotation center also changes when the components rotates around its changes because it will help us to allows us to image and confirm the proper elliptical shape of our dental arches. So this is the rotation center image. And types of rotation centers are double centered rotation, triple centered rotation, and moving centered rotation. So these are the three centers of rotation in the previously used dental panoramic machines. The first rotation will be from the contralateral first premolar in the posterior region, then same on the contralateral posterior segment, and one will be from the canine to canine anterior region. Nowadays, most of the dental panoramic image equipments are using moving type of rotation centers because it is actually conforms to the elliptical shape of the dental arches. Now, one of the most important concepts of OPG is the use of focal thrust or image layer. This is a three-dimensional curved zone in which the structures which is lying within this curved zones are clearly demonstrated in a panoramic view. Any structures which is away from this zone is actually blurred or less clear. So in a panoramic machine, you cannot find the focal thrust because focal thrust is a concept. This image layer is actually a concept. And to achieve this focal thrust, we are supposed to place the patient in a proper position by keeping the patient's chin on the chin support region, bite on the bite lobe. All these procedures should be in a proper manner. So, a focal thrust definition is that it is a three-dimensional curved zone or image layer in which the structures which are reasonably well defined, and this is actually conforms to the elliptical shape of the arch. This is narrow in the anterior region and wide in the posterior region. This is also called as plane of acceptable detail or image layer. So the structures which is closer located between the focal thrust will be sharper, and the structures which is outside present within the cup appears to be less defined. So these are the images which shows closer to the focal thrust, that it will be more magnified. Then comes the X-ray film and paper. It will be rotating around the patient in the same manner but in the opposite side. So now you can just see the animation how an OPG film is actually formed conforming to the elliptical size of the arch. See here the red dot conforms to the rotation centers present. This is our dental arch. Now the other concept is that the X-ray tube and the film which is present on the opposite side will be rotating around the patient on the opposite side, conforming to the rotation center. The patient's dental arch is placed in the focal thrust region Remember, focal thrust it may not be visible on an equipment. This is a concept to achieve that the patient is placed in a focal thrust area. Follow the technician's instructions of keeping the chin on the cylinders, right on the bite block. Everything should be set, and then you will shoot. While shooting, this is the way how it happens. Once more, you can see the same thing. So I hope I'll stop the class today. Thank you for listening.